Hi everybody, this is Doug Nelson, the founder of Precision Neuromuscular Therapy, and I want to welcome you to Precision Neuromuscular Therapy for the shoulder. This is a one-day really immersion into a condition that presents itself often in massage therapy offices. Certainly in my clinic in Champaign, we see a lot of people with shoulder issues. And it really follows the tenets of something that we feel very strongly about in precision neuromuscular therapy, which is that many of the symptoms that people present with, they often think are deeper, more intrinsic problems, but they're actually soft tissue problems that we could really do something about. And generally people don't realize how much of a difference very focused, very precise soft tissue work can make. And that for us is really big because that's our service. That's where we fit, we think, into the healthcare community of looking at things that often fall through the cracks. And shoulder issues commonly are that. So the first part of the seminar is really looking at this, which is scapular mobility. Any movement of the shoulder is really kind of a symphony in two parts. One is the movement of the scapula, and the other one, of course, is movement of the humerus itself. We need to look at both things, and they're both interconnected. We need to, as everything else, we need to separate them first and then put them together second. So the movements of the scapula must be unrestricted. If there are any movement planes where the scapula is restricted, then that affects how you can end up moving your arm. So we'll examine all the different planes of movement and all the different muscles that are potential problems in that, of which it becomes a little bit complicated because it's about how muscles are used in groups rather than this does that and this does this. I think you'll find that whole part very fascinating. Once we look at this, then we're going to move to muscles that are attached to the humerus itself and our pure humeral motion. And again, as everything else, for us it's about being effective and efficient. So, for instance, if somebody presents with pain in the anterior shoulder, just thinking about, I can come up with at least seven different reasons that somebody might present with pain here. So as a massage therapist, how do you sort of triage through those things? How do you make those decisions? Honestly, that which is tender doesn't really tell you a lot because, for instance, many of the muscle attachments here are so close to each other that if one is sensitive, you get a spillover effect into the others, and that gives you a kind of a false positive. So you have to have some other criteria. What we show you are multiple ways, multiple criteria that you can use to make that determination. So you're really not just hanging your hat on any one thing. It's not just range of motion, it's not just strength, it's not just symptom presentation, it's not just structural. It's all of those things and more, so that you can put together a really reasonable approach of one or two or three things that might explain your client's pain. And on the way, then you will figure out, that doesn't make sense. We're going to go a slightly different way. It's important to know you're right. It's actually more important to know that you're wrong. Another note, we are massage therapists. We teach to massage therapists. You want the work generally to feel like massage. It can't be something that is just this wild, different direction for the client. It has to be satisfying for them, and it has to resonate. And I just got back from teaching a seminar, and actually somebody came in during the seminar to get work. It's really interesting what he said afterwards. He said, in the first 20 seconds, he said, I knew, this is different. He said, it was like when you put your finger right on that spot, he said, I had the feeling that I've been waiting years for somebody to put their finger there. Now, this is somebody who's had lots of massage before, but in a way, this is different. In a way, it's not. It's different in how focused it is in the way it thinks. It's not that different in that it's just these things, just hands, working with the body. It's not some sort of tool. It's not some crazy thing. It's just our hands, but in a very, very focused way. In the end, it's all about what you know. That's our goal for you. That when you take this seminar, you'll have a very clear focus about what you're doing, why you're doing it, when it works, more importantly, when it doesn't, and how you can be very flexible and in your treatment approaches and the way you do things. A lot of that has to do with our assessment techniques. And the way we do assessment is not some sort of checklist of 15 things that you run every person through. It is a very fluid, very flexible thing, some of which people know they're being assessed, some of which they really don't. And that's great, actually. I like assessment that's rather veiled. So I think you'll really appreciate the whole process of this. What really will happen is how much your clients will appreciate the effect of the work. I think you'll be surprised at the changes that you'll be able to create even in the seminar. And boy, will your clients thank you for having been at the seminar and explored this material. For us, it doesn't really count. I mean, theories are easy. It has to turn into results in the clinic. And those results have to be something that people are wowed by and want to share the word, and that does nothing but build your practice. And that if your practice is bigger, it means that you're serving more people and making a difference in the world. And that's why we do what we do, to make a difference. Please join us. I'm excited to have you there. I think you're going to love the seminar. Thank you so much.